Hey, Dr. Tracy, board certified general pediatrician, and I've received a few questions about what is going on in Florida right now with the vaccine mandates. What does this mean, and what is that going to mean for everyone else? So first of all, let's talk about why there was ever a vaccine mandate for public schools to begin with. So in the entire United States, we have public health mandates where children have to be vaccinated against certain communicable diseases prior to starting school. There are exemptions for this. There are medical exemptions if a child cannot have a certain vaccination due to allergies or certain medical conditions, and religious exemptions in some states. That allows the parent to be able to decide for themselves if they want to follow the mandate, but the mandate is there, meaning that these schools have to ask and it has to be tracked and monitored. So first of all, is this a good idea to begin with? It's never public health's first choice, if you want me to be honest. I mean, none of us want this to have to be the reality. We want people to understand why they're getting a vaccination and get a vaccination because the science says it's safe. But here's the deal in the United States. We have more mandates than other countries, right? Why is that? Because we don't provide health care to all of our citizens. And so people may not have a problem getting the vaccine, but until you mandate it, they are not able to pay for it. So when something is mandated, in order to do something public, then the government has to pay for it. So again, if we had universal health care, we wouldn't need as many mandates because a lot of people don't vaccinate, not because they don't want to, but because they didn't have access to it. So the mandates said, okay, this is important enough. We want to track it, and now we are going to force insurance companies to pay for it. We're going to force public health departments to pay for it because we can't demand people have this if we don't provide a safe way for them to do it. So that's the most important thing to remember here. This was never about not having a choice. This was about our current healthcare system does not just provide for everyone. And so this was one of the ways to get this provided and to make it be something important to people when they were signing their kid up to school. So vaccine mandates have worked in the United States. We have seen vaccination rates rise since they started in the 1970s, and we have in 1999 completely eradicated measles from the United States, polio. We see very little rotavirus anymore. Hib and Prevnar have been hugely successful in the United States. Chickenpox vaccination has been hugely successful in the United States. I haven't seen a case of classic chickenpox in over 15 years. So these vaccine mandates worked for what they needed to do, which was to get the public health information out there, show the people that how important it was, because you had the state and federal government behind the medical society saying, yes, we feel that this is so safe and important that we are willing to put our stamp on it, as well as to help provide that for the general public. So that's why the mandates were there to begin with. There was always parental choice. There was always individual choice. You could decide not to do it, sign a religious exemption, and still allow your child to be able to go to school. You also then had the choice to not enroll your child in public school and seek other forms of education. So that's where the mandates came from. What is the problem with getting rid of them? It's exactly the same reasons I just told you they were put in there to begin with. When you get rid of a mandate, all of a sudden companies can start saying, well, it's not mandated, so we're not going to pay for it. And vaccinations are expensive. So this is putting the onus back on the families to figure out potentially how are they going to find them? How are they going to get them? Who is going to pay for them? It also continues to erode in the trust of the medical system, because when the state comes out and says these shouldn't be mandated, that tells people, well, wait a minute, so are they safe? Should I be doing this? If the state doesn't think I should be doing this, I wonder if there's more information they have than I don't. So it really makes it difficult as public health officials and primary care providers to continue to provide this care, which we know works. We know is safe and effective. We have been doing this for decades. None of this is new. This is all really, really old things that have entirely changed the course of public health worldwide, not just the United States. We are not in a silo. It is not just us. Other countries do not have as many mandates because they provide public health for all of their constituents, and their vaccination rates are so high, there would be no reason to mandate it. People talk about Sweden and Japan. Again, socialized medicine, provide healthcare to all people, easy access to get vaccinations, huge public health campaigns that talk about the importance of it. Their rates are over 97%. They don't have outbreaks of these diseases, so there's no reason to mandate it. So getting rid of the mandate is dangerous because it's going to impede access for people, especially those of lower income and those who don't have insurance already. And Florida is one of the states with the largest number of uninsured children in the country. So it's going to impact them quick and hard. How does that impact the rest of you? It impacts the rest of us because we travel, we go different places, we are all over the place. You go to Florida on vacation, you come back with your 1-year-old who hasn't had a chance to be vaccinated yet for measles. You bring measles back. Next thing you know, you overwhelm a health system like mine in Vermont, which is already bursting at the brim, already having problems. And we're talking absolute pandemonium. It's not going to be good. It's not safe. It's going down the wrong direction. If you wanted to give more personal choice, put your weight behind the medical societies and say, let's work on this together. Let's have huge public health campaigns where we really get the science out to people. We talk to people, we use certain language, we shut down some of this misinformation that is out there. We stop making things political theater and we go back to the basics, which is public health. State and federal governments and primary care providers need to work together to help instill trust in the public, into the public themselves, so that they understand what are they supposed to do. So I'll give you a little story. This has happened to me my entire time in primary care, but I constantly get families saying, well, I only want the vaccinations that are mandated. So even if someone has access, they see that mandate superseding what I would recommend. And for the longest time, it really meshed together, so it wasn't a huge problem. But now we're going to get it more and more and more. So this is extremely dangerous. There is no public health official on the planet that thinks that this is a good idea. It is not going to go well, and it is not giving you any more public freedom. You already had the freedom in Florida. You did not have to vaccinate your child. You had informed consent, and everyone had access. Now, there is a lot less informed consent, there is fear, there is mistrust, and this is going to erode access. And the most vulnerable are going to be the ones that suffer the most. So if you care about this issue, write your state representatives, tell them you don't want this to happen, that you already had parental choice, that we don't want to take access away from the most vulnerable, and we don't want to deal with the public health crisis. So if you have any questions, I'm happy to try to answer them on here, but talk to your primary care provider, talk to people that you trust, get involved. This is dangerous. If we don't start acting now, we are not going to have a public health system for the next generation, and this is a really, really big deal. I can't impress that enough. So please take care, research this information, read about it, look into vaccine mandates, really look into the way Sweden and Japan did this, and ask the right questions, and please, please get involved in your local politics. Take care.